Hello, welcome to the Telesummit. I am so excited to introduce you to my very good friend, Stephanie Aman. She is the Associate Chief Nurse Executive at the University of Miami Health System. She also is a Watson Caring Science Scholar and a Caritas coach. Stephanie and I just recently went to the Middle East, and we were in Jordan at the Middle Eastern Conference for Watson Caring Science, and we connected at that time. And I've known her for a long time, and she has been someone that I have tremendous admiration for. She has been a nursing leader. She is one of the most visionary nurses I have ever met, and I'm so excited to share her with you. And as we step into the future and we're contemplating what the future of nursing is and what the next steps we want to take for the co-creation of our discipline and our profession, I am so honored that she has agreed to be one of my speakers. So Stephanie, welcome.
Mary, thank you so much. I'm honored to be here, and your words are so kind. Thank you for including me in what I think is a visionary opportunity for nurses to discuss the discipline and to co-create our own future. So thank you for your inclusion.
Thank you. So I've had this at Telesummit has been an absolutely revolutionary experience for me, and everyone has a really unique perspective to offer. And you've been in nursing a long time, and you've been at the front lines now, and as very involved with clinical and hospitals and healthcare systems. And as we move into the future, moving past where we're at right now, what are we learning at this time about where we need to go forward, and what are the best things we need to do to create the future of what can manifest? Even if it's not here today, what are the possibilities for the future?
That's a great question, and I've actually spent a lot of time thinking about this in preparation for today and knowing that we would be speaking. And in the course of my career, I've seen a lot at different points in time. I worked doing HIV work. I worked with a team that did the first face transplant in the United States in Boston. I worked through Ebola, Boston Marathon bombing, live active shooter in the building. I mean, there's been in the course of my career, I've encountered a lot of the big things that you don't often anticipate you'll encounter in a career. And I was thinking about, how does one become prepared for the world that we're functioning in today and the complexities of the environment that we're in. And I think as I reflect on these things in light of the pandemic that we are experiencing right now with COVID-19, if I were to look at these things and think about what does nursing need to do for the future, I think there's two ways of looking at this. I think what should stay the same, what should change, right? And that as nurses, we have a contract with humanity, a covenant with society. We hold humanity in our hands. Right. I think that the work that we do as nurses has become entirely almost driven by physician reimbursement. Therefore, it's driving the financial model of healthcare rather than delivering what society needs from nurses. And if I think this is the year of the nurse, this is the year of Florence Nightingale's birthday, right?
Yes.
We need to reflect more on our contract with humanity. We need to think more about the ethics of healthcare. We need to, in this pandemic, we are seeing disproportionate numbers of people of color, people who are poor becoming infected with this virus, and the mortality rates reflect that their experience with this pandemic is different than the experience of others. That goes back to what really has been a sexy conversation in our society about social determinants of health. But right. It's one that we have truly put our backbone behind. And we're seeing it be addressed now in small ways because people are trying to contain costs, but it needs to be driven by more than containing costs. And I'm giving you a long-winded answer, but I'm sort of thinking about these things, and I'm thinking about Levinasian ethics and the ethics of belonging and the ethic of face in people who in our society remain unseen,
Right.
don't have access to the same health care. And in 2008, our country experienced a tremendous financial crash, and people lost their jobs. And at that point in time, it became obvious that we should not have health insurance commingled with your employment, because if you lose your job, you will no longer have insurance.
Mm-hmm.
We now have people losing their jobs. And Obamacare isn't perfect. It will probably save some people, but the truth of the matter is, at the end of the day, if you can't pay your premium, we're in the same place we were in 2008, where people are going to start to not have access to health care. And if we believe that health is a fundamental human right, and if as a discipline we don't believe that, there's something wrong with us, right? I mean, that's really at the core and the foundation of what we do. If we don't believe that health is a human right, then we belong out of this business. If we do believe that health is a human right, then we have an obligation to be engaged in a different dialogue that takes us away from the bedside and illuminates the voice and the needs of those who have remained unseen,
Mm-hmm.
to advocate for a more just society that creates well-being for everyone. And so I think nurses traditionally think of nursing roles at the bedside. And so
Right.
one of the things that I think nurses need for the future is to become more dexterous in health policy, into bringing the voice of others to the forefront at the community level and with the politicians, and advocating for resources.
So tell me some of the steps that we can take today to be able to do that. What are just common sense next step? Let's do it.
Here's a real basic, right? This is a real basic. I think if we were to go around and poll nurses and ask how many of them are members of their professional organizations.
Okay.
Professional organizations for nurses advocate for issues that are important to nursing, and they don't often have huge budgets. So one of the first things I would say is that they should become a member of their professional organization. There's a difference between a job and a discipline. And to me, as I've talked to nurses throughout this pandemic, nurses who've been afraid to go in, right?
Right.
I've said, never has that intersection of nursing with our covenant with society been more apparent than it is today, where you're asking the nurse to put her own needs on the back burner to go in and save the lives of patients, right? And so I think one of the most basic things is advocating that nurses become members of their professional organizations, that we shift the impression of nurses as angels. Nurses, lots of people are angels, and nurses are certainly doing, I say God's work, right?
Right.
But nurses are highly skilled, intelligent, capable human beings who have extensive education and training that prepares them for their roles, and they should be viewed as such, and their contributions, therefore, to the voice of healthcare systems,
Right.
and to the overarching healthcare agenda of our country should be valued and included. And nurses need to learn to get their voices inserted in those discussions. So you become a member of your professional organization, because your responsibility and your contract extends beyond your 3 o'clock shift.
Right.
It's like, so another thing you can do is vote in a way that aligns with a humanistic agenda. one that supports that. So you don't have to go out and go donate, a bunch of money. You don't have to go volunteer 20 hours on the street, but there are small things that you can start to do that are in alignment with your perception of your role as a member of a discipline rather than a job. That there is a difference between those two things, right? And at the crux of it, we're holding humanity in our hand. And so it makes it really important that we're advancing the voice of the nurse. Right?
Exactly. Tell me about the discipline in It's Not Just a Job. Speak to that.
I think a job is this thing that you do for a paycheck, and we all need a job. But there are a handful of jobs that have a different level of responsibility to the community, to humanity, nursing, police officers, firemen, these types of roles, teachers, right?
Right.
And I would tell you, and I say this all the time, I've held elected office.
Right.
I believe being a politician is one of those things. And what I think that at times we experience, without going into, political agendas or things like that, or political parties, because no party is perfect. I think we need to push beyond the party to see ourselves as one and advance an agenda that goes with that values both sides of the coin. There are things that are right with both sides of this, but I think at times you can see within the political system that people go into this to advance their own agenda and not necessarily what's in the best interest of society, right?
Yes.
And that I wish we had more nurses who sat in office and who were more consensus builders and who talked about both sides, because truthfully, this pandemic has underscored some of this, right? Like, how do you balance quarantining and people staying and sheltering in place, if you will? I don't like the language, but that's the language that's being used right now, with an economy that needs to advance, because one way or another, people are being impacted, right? In very deleterious ways. And so I don't think that's an easy thing to do, but there's a person who can sit in a seat and do this work and do it in a way that's a consensus builder, right? Or you can look at the set of cards that we've been handed here and say, how can I turn this into something that advances society as a whole? They closed the schools. There are children who are at home and they're being told to take their classes online, who in this country do not have internet in the home, right? We are not all dealing, so people are being told you'll have telehealth and you'll access your health care via the computer. We don't all have the same set of conditions right now.
Right.
How do we decide what is a basic set of conditions in this country? And I think nurses have a lot to bring to that discussion. And when you look at the disproportionate mortality rates, they're likening it to things related to hypertension and diabetes and chronic disease. And those are things that we know people of color have far higher rates of than others. So there's a place for nurses in health policy discussion. And I believe that nurses would turn it away from a thing that's not driven around reimbursement, which it's important too. Hospitals have to make money and have to have their doors open, but there is a broader conversation that needs to be had. And I believe nurses would drive it because they're not being reimbursed for the discussion. They're just coming in and saying, I'm here to be an advocate for society.
Exactly. To be an advocate for society. And I think the idea of us being able to really stand up and speak out, that's what this is a call to. How can we get our voices heard? And how can we can join a professional socialization that we can have a voice in. We can get more involved in stating orders. Could you tell me more actions that you see a nurse who is just working at in our discipline? Our discipline really is a covenant with humanity. Tell me other steps that you see that we can take so we can move into this future, being able to have a conversation with the appropriate people to be an advocate for what's needed for society and not the reimbursement system.
Yeah. So I think you can start with being an advocate on your unit and becoming a voice in your unit. You can look, a lot of times people don't pay attention to what is the vision, mission, and values of the organization that they work in, and to ensure that the vision, mission, and values of that organization are aligned with advancing a humanistic society. I think most hospitals, you'll see that they do have a vision that's aligned that way, but then you need to take that one step further and say, is there a congruence between organizational action and what's written on the piece of paper? And I've worked in lots of places where, you know, I've sat on the edge of the poorest neighborhoods in the city and different things like that, where there might not have been the strongest commitment and action to those places. I worked for with a nurse leader who I know was a really big advocate. You know, Jackie Somerville, she was a big advocate for the people who live in our neighborhood as health reform started to evolve, and it was big. It was apparent that people were going to be paying higher out-of-pocket costs for health care. She was very concerned that people who lived in our neighborhood, the neighborhood of the organization, that the patients were able to come and get care. And she aligned nursing time to sit on committees and different things like that, where we would be able to influence that. So if never you want to leave your organization, but you want to advance a humanistic world, you can think about how I vote, and do I vote in a way that it advances humanity, right?
Right.
I'm a member of my professional organization. Are my personal actions aligned with advancing a humanistic society? Am I an advocate on my unit and a leader for this on my unit? Because within every unit, there are ways that you can be doing this in small ways, and small ways matter. You can advocate for broader system change in your organization. You can run for office in your small town. I was the chairman of the Board of Health for a number of years in the town I grew up in, and I did it because I felt I owed something to the community after I graduated. And I learned a lot. I learned a lot about community planning and development, and how is Main Street developed, and where is the parking, and where is and believe it or not, those things matter, and they contribute to healthy environments. The Robert Wood Johnson Foundation is doing some really great work called Creating a Culture of Health. And, you know, there are neighborhoods that have street lights and sidewalks, and other neighborhoods that don't, or farmers markets and bicycle exchanges. And these things create environments in which, so those are small ways. I'm not saying you've got to go out and go, you know, volunteer for a presidential committee or do whatever, but there are small things that we can do that impact the communities that we live in, and we should be doing them. And we should be pressing our elected officials. I would say every nurse, your elected official should know your name. I lead a lot of policy work in Massachusetts to advance. I'm living in Miami. I still am the health policy director for the Massachusetts Coalition of Nurse Practitioners, and I've been leading their charge for full practice authority for, I think, the last 8 or 9 years. And I am regularly telling nurse practitioners, write to your elected officials. So know who your elected officials are. Let them know when they are falling short. The environment matters, right?
The environment matters, yes.
Environment matters. Maybe that's a small place where you can just pick one thing that you were going to do. And the other thing I would say that is another important thing for nurses to do is to really, it's Caritas process number 1, you know, engaging in a practice of loving kindness with self and others, which is the foundation for a practice of self-care. And at different points in time in my career, I will admit it, but I'm embarrassed to admit it, I haven't seen that as important. And when I became a Caritas coach, I really paused and thought about that. And truthfully, the realization that I came to is that how I take care of myself is how I would take care of others. And so as nurses, we are an example for the people that we are interfacing with. Our first actions on caring should be extended to ourselves. As nurse managers and nurse leaders, if you're working through lunchtime and you're not taking the time to take care of yourself, you know, you're not going to make sure that your staff has time to take care of themselves, or it will be less important and less in your forefront. So I think creating a culture of caring is what's important, and that we make sure that that extends to our actions and what we do as nurses, that we are members of political organizations and professional organizations that advance a humanistic agenda, that maybe humanistic agendas can sometimes feel lofty and out in the stratosphere.
Right.
Okay, you got to start somewhere and you got to aim for somewhere, and maybe you land in between. Change happens incrementally, but your
Right.
nurse is important to it. And as long as you don't bring your voice forward, people don't hear what nurses think are important. And so all you hear is about reimbursement. And so the practice of nursing has become driven by what is reimbursed, and we are sitting here waiting for a computer order to call us to care. We have been called to care long before now. Long before Florence Nightingale, we have been called to care, right? She professionalized our discipline. But in this year of the nurse, in the year of her birthday, let us reflect on her, because she was a political mover and shaker.
She was.
Oh my God, she was, right? And
Yes.
so it is time for nursing to take our place amongst our peers and colleagues, and for our voices to be heard and to be engaged politically. So I think getting engaged politically, and that's not always obvious, and it doesn't have to be your life's work. It can start in small and private ways in the voting booth to much bigger ways where you might get involved at your community level.
Well, that excites me, because one of the things as a citizen, as a nurse, and as a citizen, one of the things I've had a tremendous passion about was saving the environment for clean air, clean water, having, saving the trees and the nature for community. And what I realized one day is I thought, this is really important to me. I think one of the reasons why it's so deeply important to me is because I am a nurse, and helping and protecting the environment. The health of the environment is in protecting the health of the human being, because we are connected. And when I stepped into knowing that, feeling that kind of passion of being an advocate for the environment, because I'm a nurse who's advocating that, I was able to almost step into a different way of relating to it, because as a nurse, I have a covenant with humanity, and this is my contribution as a nurse to protect the environment, as my education, my professionalism, my activism. That's part of who I am as a nurse. It's not just my job that I take my role out into the world and contribute to the community. It's in my being a citizen in a community, I take my role of who I am as a nurse out to benefit the community.
The fact that we're licensed as nurses, you don't shed that responsibility when you step out of the door of the institution. You still have that responsibility, and through that licensure, right, that is society telling and authorizing nurses to practice in a way that is aligned with societal needs. That's what that means, that contract to humanity, that contract to society. So if we weren't licensed, you'd be just like everybody else. But that license, through the process, you are stepping up and saying, I will do this. As I reflect on you talking about the environment, Dr. Watson gives language to that, because she talks about an eco-caring consciousness. Again, for many years, I was so involved in my own, like taking care of my son and my own education, and probably hadn't given a lot of thought to that. As I went through my program to become a Caritas coach, I became exposed to that language. And it was funny, because when I left, I think it was Wisconsin that we were in, and I was coming home, my husband had always wanted to have chickens, and I always said no. And I told him yes, right? This time I said, yes, you could. And it was really because this thing had awoken in me that I became really thoughtful to my connection to the earth and the world around me. And I would sit there and I would, at the end of the day, have a cup of tea and watch my chickens free range. And of course, that was really restorative to me, but it also gave me time to pause and think about the mysteries and the miracles of the world around us that we just sort of take for granted, that the sun comes up every day, that we're all healthy and we can walk about, until boom, you've got a pandemic and you can't do those things anymore, right? And so I think it is very important, and I don't think it's something separate from nursing. I think as nurses, we should be having these conversations. And so I got these chickens, and I was talking to a nurse at work one day, and I said to her, she was asking, "You have chickens?" And I said, "Yeah, would you like me to bring you some eggs?" And she said, "Oh, no. Oh, I wouldn't want those." And I said, "Well, do you eat eggs?" And she said, "Yeah, but I get them at the supermarket." And it really underscored for me how disconnected we have been from the world around us, that we think food comes from the supermarket and not from the world around us, right? From farms and these places. And you can look at, again, go back to social determinants of health and look at what happened to kids in Detroit with lead poisoning. Look at what's happening in these different communities, that the native peoples right now who are being impacted so adversely between COVID right now has had a really deleterious impact on Native peoples, but also with the lack of respect for their water supply and things like that that we had in their environment. So, you know, we're seeing this in communities. The community I grew up in had a Superfund site in it, you know, and there were just things that weren't going to happen in a wealthier community because the people's voices would have been projected and heard in a different way. And so as discipline, I think we have an obligation to illuminate the voices of others in ways big and small. They all matter. And you just start, and then you find your way with it. And for me, it's my passion, right? I'm really passionate about politics and the role of the nurse in politics to create a humanistic society, because you know, my focus in my doctoral studies with Dr. Watson was Levinasian ethics, the ethic of faith and the ethic of belonging, right? And there are people who live on the margins of society who are not seen. And we are giving away a piece of our own humanity when we allow that to continue.
Mm-hmm. Well, Stephanie, I think that's incredible. Politics and the role of the nurse, I think, is really critical. And that's what I've gotten out of, you know, that's activated in me right now, is like, how can we get more involved in our associations, more involved in our communities, more involved in getting people who are politicians to know who we are and be activists in and meeting the needs of society and the people who are marginalized. And I think that is key from what you're saying, and how we should move forward into the future and become those advocates. And really, as a full, you know, like you said, we have a license to have, and we have a covenant with humanity, and it's beyond just having a job.
Correct. If society didn't need something from us, we wouldn't be licensed to do it. You would just go get a job. And other jobs are important too, right? They're all important. But by virtue of the fact that we are licensed, it says something different about us.
Yes. Well, thank you so much for this incredible opportunity to interview you. It's been, you know, during this hard time, it's been, you know, really a challenge to get a hold of each other, but we did it. And I just want to thank you so much. And I want to appreciate you for the work and the leadership and, you know, the wisdom that you've shared. I think you're out of all the interviews, you're the first one who's really talked about this specifically, of how we can become more politically involved. And I do believe that is one of the things that we have to do more of.
Thank you, Mary. I really love that you had this vision of creating these videos and using this time in a way that gives opportunity to bring the voice of so many different nurses together I hope that some of them are staff nurses that you're going to be interviewing who are on the front lines right now, because I think whatever they will share with us will be rich, and I'm excited to see this project. Thank you for including me. Heartfelt.
Thank you. Thank you so much.